Good evening, everyone, and welcome to Pull Up with Limbs and Things. My name is Dr. Chanel James, and I'm the owner of Limbs and Things, mobile and telehealth physical therapy practice. We serve aging adults in DC, in Maryland, and in Virginia. We help you move from I can't to I can. So we have tonight Dr. Nicholas Weber. He is the chiropractor and owner of Nova Spine and Wellness. And tonight we're talking about how we help aging adults with physical therapy as well as chiropractic care. Welcome, Dr. Weber. How are you?
Thank you. It's great to be here. I'm fantastic. How are you?
I'm good. We actually met, probably earlier this year. Is that right?
Yeah, that sounds right.
Okay. And so at that time, we had discussed a lot of different things about our different practices, even though we're in the same area, and how we've had similar challenges, but some that have been directly related to aging adults. And so tonight, we wanted to talk a little bit about how we help aging adults. So, Dr. Weber, I want to give you an opportunity to introduce Nova Spine and Wellness, rather.
So Nova Spine and Wellness is a clinic where we focus on bringing the latest in evidence-based care to our patients. Now, what does evidence-based care mean? It means that all of our treatment protocols are based off of the latest research that indicate that what we are doing is not only appropriate, but is also shown to have the best results, not only in helping our patients out of the pain and symptoms that they're here for now, but also in trying to ensure that we can rehabilitate their spines so that those results hold and we get long-term results for our patients. The whole goal is to ensure that as the spine ages, as it does, that we can prevent undue degeneration, prevent risk of injury, and just ensure that as our patients get older, they can maintain high levels of function and low levels of pain. So it's really, very, very hand in hand with working with aging adults. Everything that we do is geared at trying to ensure that our patients are able to maintain their quality of life as they get older.
Hmm. So let's talk about how you do that with chiropractic care.
So we use a very specific technique, again, evidence-based chiropractic. It's called chiropractic biophysics, and it essentially analyzes the spine from a very unique perspective. Everything that we do is very unique and different, even in the world of chiropractic. So we analyze the spine from a biomechanical perspective and try and find out where our patients' spines deviate from what is a normal spine. That normal spinal model has been verified through research of looking at patients who don't have pain, don't have injuries, don't have spinal deformities like scoliosis, and have very high levels of function and low levels of pain. So once we analyze our patients' spines and we compare them to normal through our line drawing, then we do the traditional chiropractic adjustment, which is to help with pain, help with range of motion, decrease inflammation, release interference between the brain and the body. And then we utilize postural exercises and traction to rehab the ligaments of the spine to establish normal biomechanics in the spinal column.
Sounds good. Sounds a lot like what PTs do as well. We want to talk about the difference between the two.
So typically, one of the biggest differences is that as a chiropractor, I focus on the spine. We can treat pretty much any joint in the body that moves. As chiropractors, we say if it can move, you can adjust it. That being said, my expertise lies with the spine, and there are certainly realms of quote unquote physical therapy that I was taught in school that simply are better suited to somebody who spent 3 to 4 years getting a degree to do those things. I actually find that when I have patients who are under care of both a physical therapist and a chiropractor at the same time, that we typically get better results with them because I can only do so much in one visit. And again, that's focused on the spine. But when I know that I can basically, hand them off to a physical therapist who's then going to work on the muscles, work on balance, work on strengthening, finding their deficiencies in muscular strength and balances, that it all works very cohesively together so that we can kind of hit it all from, different perspectives and make sure that they're getting everything they need to heal.
Well, that sounds good. Okay, so if you are watching and you have a question or a comment, please feel free to put those in the comments section. And if you're watching and you are live, we would appreciate knowing because we can't see you. So hashtag live. And if this is something you're catching on the replay, you can hashtag replay and then we'll know that you have seen it. So thank you all so much for watching. We'll get back to letting Dr. Weber talk about all the things that they do at Nova Spine and Wellness. So tell us about, like, when a person comes to visit your office, what the initial process is in terms of analyzing their spine.
So we have a lot of different methods of analyzing the spine. Number one, we just start basically with range of motion. We want to see how you're moving. We do know that decreases in range of motion can be strong predictors for future disability, especially when you're talking about somebody with some kind of a trauma like a motor vehicle collision. So we always start there. After that, we'll go through a series of orthopedic and neurologic tests to include, but not limited to, reflexes, muscular strengths. We always look at dermatomes. Dermatomes are basically nerve sensory pathways along the body that are distributed in a very finite and discrete pattern, so that we know if we have a deficiency in one of those dermatomes, it's relatable to an exact spinal level. So it's very good information. And then after we have completed all of those tests, use the orthopedic test to stress the tissues in and around the spine and the area of complaint, so we can try and discern if it is a muscle, a ligament, a tendon, or some other kind of injury. Then we move on to the X-rays. We do full spine X-rays on all of our patients. And when we take those X-rays, we then use our line drawing analysis to analyze the biomechanical perspective of that spine. And again, this is where the chiropractic biophysics technique comes in. And then we, again, compare that spine to our normal model of a spine and find where our patients are deviating from normal, and devise a plan specified specifically for that patient's spine to get them back to a normal spinal model.
Sounds good. So everyone doesn't necessarily go through traction, right?
Most of the time, people are going through traction. Even in asymptomatic patients, I think I've found maybe one or two patients in my entire career that haven't needed spinal rehab. We call them like the unicorns. For some reason, they have been gifted with a beautiful spine, and they've probably avoided some injuries that most other people have not been lucky enough to avoid. But generally speaking, most people always have one or two things that we can traction. And again, even if it's not an area of complaint, our research indicates that, sooner or later, if they have certain factors, it will be an area of complaint. So it's only doing the right thing if you find something that is going to be a problem and you want to prevent it from becoming a problem. So I treat all my patients, regardless of symptomatology. If they have an area in their spine that needs to be worked on, that area of their spine is definably injured by the research. So we need to treat that spinal injury, even if it wasn't something like a whiplash incident. It doesn't matter. Their spine is still not in the right place, and we need to rehab it so that we can ensure that it doesn't degenerate too quickly, leave them susceptible to future injuries, and just ensure that as they get older, it doesn't become a problem. Because preventative medicine is far more effective than reactive medicine.
Absolutely.
If it's already a problem, then you're late to the party. We got to make sure that if we find something, we treat it now so that it doesn't become an issue that starts interfering with your quality of life.
Yep. That's true. That's true in physical therapy as well. We want to do our best to prevent, rehab, and possibly even maintain the person's highest level of life, quality of life.
Absolutely.
Okay.
That's why we do it.
That's right. There's a question here. Let's see. If you have pain in your legs, should you try to go to a chiropractor for an analysis of your spine?
I might be a little biased here, but I would think yes. Specifically, if we have pain that's in that classic sciatica description. For those of you who aren't familiar with what sciatica is, it's typically a nerve-like, which could mean burning, shocking, stabbing, shooting pain from your back, down your buttocks and down the back of your leg, possibly wrapping around the front of the leg. That's definitely something that chiropractors can treat. Specifically, again, if we take X-rays and we find that you have not enough curve in your low back or maybe too much curve in your low back, that's a very treatable condition that we can rehab. And many times when we see something like that, it's a postural abnormality that has gone unchecked for a long period of time. It could have resulted from a trauma earlier in life where they had an instance of low back pain where somebody threw their back out and it was really bad for a couple weeks. Then it got better, and now they've just been going up and down and up and down. And that's also something that physical therapy can absolutely help with, because, again, as we're working on the spine, I can work on your spine all day long, but if you have other muscular imbalances that are going to lend you to go back to that same movement pattern that helped get you there in the first place, it's only a matter of time before that movement pattern comes back and could predispose you to injuring it once again.
Agreed. All right, the follow-up question, does weight cause spine pain? I guess there's fluctuation in weight that we mean.
Yeah, weight can definitely cause spine pain. And again, everybody has a different distribution of body weight. Some people have extra body weight around the waist, some people around the thighs, some people around the abdomen. There is something known as pendulous abdomen when excess abdominal adipose tissue or fat tissue can actually lend to pulling forward of your low back or your lumbar spine, and that produces a lot of what we call shear force on the disc. So your vertebra has motion segments that are vertebra stacked on top of each other with a disc in the middle. And when there's too much pull from the front, your vertebra physically want to slide forward on each other like that. Now that can definitely stress the disc that's in between and can lead to disc bulges and in very severe cases, disc herniations. We do find that that can be a factor. And in many times when I have patients who have such a presentation, I absolutely recommend trying to lose some of that weight to try and decrease the mechanical load on the spine. Because the spine, at the end of the day, it is the housing unit of not only the conduit from your brain to the rest of your body, but it is also a load-bearing column, much like in a bridge. So if there's too much strain on that load-bearing column, it is only a matter of time before it starts to break down. So limiting the load that is placed on it certainly helps.
Absolutely. Yep. Okay, so let's talk about the differences between our professions. Okay, so with physical therapy, a lot of what you mentioned is very true in terms of sciatic pain. If we take that, having to analyze someone's spine. So, from a physical therapist perspective, we look at how someone is functioning, where their pain is actually occurring with their movement, but also testing their strength, testing their balance, testing their range of motion, as you mentioned, seeing how your muscles are moving while you bend, while you extend your back, all of those different ways that we assess it, as well as looking at your posture. Posture is highly important in how you're moving. And so we look at shoe choice, we look at how you're holding bags, how you are walking, all of those different load bearing things that occur to your spine. Those are just some of the ways that I was thinking when you were talking that affect how we assess someone through physical therapy. But did you want to add anything else?
Really, again, it's just back to the shape of your spine. As you mentioned, posture has a huge impact on that. We often say that posture is the window to your spine. So you want to know exactly where your spine is and where it deviates from normal. Because at the end of the day, any side of this equation you're on, if you're only doing part of it, chances are that sooner or later it's going to come back because the human body is a unit. It all works together. So if we only treat one facet of it, then we're not really solving the root cause of the problem. And we're not here to put a Band-Aid on it. That's not what we want to do. We want to fix the root cause of the problem for good. Then we can ensure that you get the results you want and that the results hold over the long period of time. If we don't fix biomechanical problems in the spine or in the muscular system, it's just not doing the full job.
Exactly. Yep. And then also with physical therapy, we do manual therapy, but the realm of talking about like your spine, how you guys analyze through Xrays and seeing deeper into the tissues, that's a difference that I think a lot of us don't necessarily know that you all do. So I'm glad you brought that up too.
Yep, we are spine experts first and foremost, and there's a lot of different ways to treat it, but in my experience, taking X-rays gives us more information than if we didn't take X-rays. I would love to have X-ray vision and just be able to see things. That would be awesome. Make my job very easy. But that's not how it is. And when I have patients who say, "Well, do I really need X-rays?" I always say, "Would you rather I guess about your health, or would you rather I be sure?" Because I don't like guessing about somebody's condition.
Oh yeah.
They deserve to not have a guess to why their condition is occurring. They deserve to have an answer, and X-rays will provide those answers.
I agree. So, how should we contact you?
You can contact me by phone or email. My number is 703-447-1121. email is drnick@novasandw.com. And you can also go to my website, novaspineandwellness.com, and schedule through our app on the website there.
And where are you located, Dr. Nick?
We are in Vienna, right on Maple Street, 360 Maple Avenue West. I would like to say we'll be moving offices early December in a few weeks. So that will be in Fairfax, just 10 minutes down the road. So we'll be updating all of our information, putting out an email on Facebook, putting it on blast everywhere so people know as well.
Oh, that's great.
We'll be adding a lot of new equipment when we get to our new location that will really enhance the care that we can give and also allow us to treat more conditions.
Mm-hmm. So let's talk about some of the conditions that you treat, and specifically people who are aging adults.
Aging adults, a lot of times what we're focusing on is, again, posture. As we get older, posture tends to degrade. There are lots of studies that show that spinal curvatures and balances degrade in every decade of life. And with that comes a concomitant increase in pain and decrease in what we call health-related quality of life. So posture first and foremost. As we age, the spine degenerates. Again, that is a function of spinal posture. So we definitely take X-rays, and we want to, number one, make sure that all of our patients are safe to adjust, first and foremost. If we have an elderly patient, let's say we have an elderly woman, she hasn't had her bone mineral density checked, we absolutely need those X-rays to ensure that her bone mineral density is strong enough to handle a typical chiropractic adjustment. If not, that's okay. We still have ways that we can treat that patient and get great results, but that is information that we need to know. We also want to look for the amount of degeneration. Have the discs degenerated? Are there osteophytes or bone spur formation? Is it possible that spinal stenosis is there? You know, that's all very important information that we need to know. Mm-hmm. But generally, the treatment is, again, very specialized to their spine. And again, back to the biomechanics, we want to rehab their spinal curvatures and their posture to get them as close to normal as possible. Typically, rehabbing curves is more difficult as the patient ages and has more degeneration in their spine. That being said, I have had a lot of patients who, even if we don't achieve full spinal correction in terms of the curvatures and balances of their spine, they're still a little bit closer to normal, and we get symptomatic relief. And even if we're getting just a few degrees or a few millimeters closer, that is you know, the goal. We just want to get them as close to normal as possible so we can try and alleviate as much of the strain on their spine as we can.
Gotcha. Okay. So if you have someone who has more cervical pain or neck pain, and you want to assist them in not being so hunched over or having that type of posture when they are, say, just sitting in their chair, you know how people tend to sit like this? Yeah. What would you say is the best treatment for you?
Well, a lot of times we're going to do some exercises to strengthen the spinal erectors, or the muscles that run right along your spine up the middle of your back that help keep you erect and upright. So again, that is a very, PT possible route of treatment as well. But making sure that the curve of their neck is appropriate. As we stick our head out forward, we tend to lose cervical curvature. And the effect that has on all of the muscles through the upper back and even down to the mid and even lower back is rather profound. Once you get outside of talking about the musculoskeletal system, it also impacts your spinal cord at a pretty severe level. If you were to take the back of your wrist and pinch right here, and you can move that skin around, that's what a healthy spine does in your spinal canal. It moves around a bit as you move. With forward head posture, it gets physically tethered. It gets tighter.
Yeah.
So reducing forward head posture and putting a curve into the neck helps reduce the tethering on that cord and give it more room to move, and help not only decrease pain, inflammation, but also allow your brain to communicate effectively with your body so that all of your muscles are firing at a rate that they're supposed to. Your body's healing more effectively. When you're doing those exercises, your brain-body connection is stronger so that the exercises are more effective. And then working on office ergonomics, ensuring that the workplace setup that they have, that they're at for 6+ hours a day, is set up in a way that doesn't predispose them to that forward-leaning posture. We need to ensure that it's a setup that allows them to remain upright and still be able to be productive and get their work done, so that, you don't just get sucked into the computer screen.
Absolutely. Okay. If you are watching and you have a question or a comment, please hashtag live so we can see you. And you can hashtag replay if you're catching this on the replay. But if you have a question, please put it in the comment for Dr. Nick or myself, and we will answer them.
Love
So,
things.
yeah. Okay. So, another one I had for you, I wanted to know, to the person who says, well, I'm too old to be adjusted, or, I've been dealing with my back for this posture for so long. Is it really worth my having an adjustment? Is there an age limit?
Is there an age limit? No, there's not an age limit. I have some patients who are getting up there in years, and as I said, we do need to know about the condition of their bone mineral density. That absolutely affects our treatment, but that doesn't rule out candidates. We have many different ways of adjusting. The spinal traction is a very gentle method of treating the spine, and bone mineral density can affect certain tractions, but most of the time they're still candidates, so we can still try and rehab their spine in that manner. And then we also have very low force methods of adjusting the spine manually. We have drop tables. Drop tables are tables that have little pop-up pieces where I pull a little lever and it pops up, and I gently push on the body and the table drops under the patient. This helps to relax muscles and also shift bones very subtly. And when I shift bone, it's not inches at a time. It's not sliding across the room. We're talking about millimeters at a time. But a millimeter of change can have a profound impact neurologically and also for pain. And we can use it to adjust posture as well, because when we're dropping the table in accordance with where we want to move the posture to, it's fast stretching muscles so they relax. And again, activating your nervous system to realize I'm in the wrong position. This is the position that I'm supposed to be in. So we're getting neurologic input to try and rewrite those pathways. Mm-hmm. So there's many different ways that we have of treating an elderly population that, is different than we would treat, let's say, somebody who's an athlete in their 20s.
Absolutely. And then for those people that we get to the point where their posture is better, and their spine has been adjusted, then they have to follow up, right? We have to do the exercises. Do you find that there are some people who just don't do the exercises after?
There's always somebody. Just like in class in high school, there's always somebody who doesn't do their homework. You can always tell.
But that's the whole point. You kind of got to make sure you follow up so that you can be even better when we are not seeing you.
Absolutely. I always tell my patients, I only see you when you're in my office. Guess what you're doing when you're not in my office? You're living life. Exactly. And life is hard on your body. Mm-hmm. If I could be with you all day long, you'd be in great shape, but I can't be. You have to do a lot of the work yourself. Taking care of yourself is a full-time job. It is not a 40-hour-a-week gig. It is a 24/7 gig.
Absolutely.
If you're not putting in the work, will you get better? Sure, to a point. But you have to take responsibility for your own health. Otherwise, you're going to be on what I call the roller coaster. You'll be better and then you'll be worse. You'll be better and then you'll be worse. Mm-hmm. If you really want to get rid of it, you've got to make your appointments and you've got to follow the advice of the healthcare professional that you're seeing.
Absolutely. I so agree. Okay. Is there anything else that you would like to share as a final thought? And if you're watching and you have a question or a comment, you can put it in there. I'll catch it.
As a final thought, I would just like to say that if you don't make time to take care of your health now, you will be forced to take time to take care of your illness later.
Say that one more time.
If you don't make time to take care of your health now, you will be forced to take time to take care of your illness later.
So true.
You're with yourself all the time. Everybody knows on some level if they're doing something they shouldn't be doing, and stopping those little things, even if it's just a little thing every day. Drink more water, eat more protein, eat less of the junk food. One small thing every day adds up to 365 things per year. And that's a lot of little things that just turned into something really big that can have a profound impact on your health and on the way you live your life.
Absolutely. Well, I thank you so much for joining us. I appreciate your sharing and kind of demystifying some of the things that we've talked about in terms of physical therapists and chiropractors. We always want to make sure that the relationships we establish are ones that are amicable, but also ones that people understand that different professions can work together well, even though there may be a history of one that is not.
Absolutely. I always tell people having more than one perspective on a problem leads to better solutions. Everybody should have a healthcare team. There's not an end all and be all of you see this one person for every system in your body.
Right. And then you should make sure that they are knowing that you're seeing someone else so that the care doesn't, or that it's aligned so that it's both beneficial to you and not that you're receiving kind of the same treatment, but ones that are complementary.
Exactly. Complementary treatments are where it's at. When everybody is seeing multiple professionals and they all have the same goal and they're all sure of what the other providers are doing and how they can assist to get the patient to where they need to be.
Yeah.
Perfect.
Exactly. Well, I thank you so much. I wish you all the best as you move to your new location.
Thank you. Thank you.
Yeah. So if you are interested in seeing Dr. Weber, he is at Nova Spine and Wellness, and they're in Vienna, Virginia, in the DC area. If you are interested in physical therapy, you can contact LimbsNThings, and we are at 202-643-2636, or you can send us an email at limbsandthings@gmail.com. Thank you all so much for watching. Have a good evening. Hope you had a great Thanksgiving. Bye.